So you've been told you need a LEEP procedure, and I bet your mind is racing with questions. That is totally normal. And that's exactly why we're here, to walk through this whole thing together, step by step, so we can turn that uncertainty into confidence.
All right, so here's our game plan. We're going to cover what a LEEP even is, walk through the actual procedure, and talk about recovery. Then we'll get into the risks and benefits and what happens long term. Super simple, and by the end, you'll have the full picture.
Okay, so first things first, let's tackle the big question. What in the world is a LEEP and why is it done?
So think of a LEEP as a really precise, targeted treatment. It stands for Loop Electrosurgical Excision Procedure. Yeah, it's a mouthful. But what it really means is they use this tiny, thin wire loop with a low-voltage electrical current to remove abnormal cells from the cervix. What's cool is it's a 2-for-1 deal. It's a treatment because it gets rid of those cells, but it also gives us a tissue sample to send off for a closer look, so your doctor gets a much clearer picture of what's going on.
Now, one thing to get straight is that a LEEP doesn't just happen out of nowhere. It's actually a really smart, proactive step. It's usually recommended after you've had an abnormal pap smear and then a biopsy that confirms some higher-grade cell changes. The whole point is to be preventative, to get in there and remove those cells before they have any chance of turning into something more serious down the road. Okay, so we know the what and why. Now let's get into the how, the procedure itself. And you might be surprised to hear this, but it's really fast. We're talking 10, maybe 20 minutes, and you're all done.
Before you go in, there's a tiny bit of prep. Your doctor will give you the specifics, but usually it means avoiding things like sex or tampons for a day or two. A good pro tip: many doctors suggest taking something like ibuprofen about an hour before your appointment. It can really help with any cramping.
The whole thing is actually pretty simple when you break it down into 4 steps. First, it'll feel a lot like getting a pap smear. They'll use a speculum to get a clear view. Then, step 2, they'll inject some local anesthetic to completely numb the area. You won't feel any pain. Step 3 is the main event. The wire loop does its job and removes the tissue. And finally, they'll use a special paste or a technique called cauterization to make sure any bleeding stops right away.
Okay, the million-dollar question. What does it feel like? You'll probably feel a little pinch or a cramp when they give you the numbing shot. After that, it's mostly just a feeling of pressure. Oh, and you might notice a slight smell. That's totally normal. It's just part of the process to control bleeding. But honestly, most people say it's very tolerable. All right, so the procedure's over. Now the focus shifts to recovery. Let's talk about what that healing journey looks like.
Your recovery is usually pretty predictable. The first day or two, you might feel some cramping, kind of like period cramps. Then, for the next few weeks, don't be surprised if you have a watery, brownish discharge. Some people say it looks like coffee grounds. It sounds a little weird, but it's a completely normal sign that you're healing up just right. Knowing that ahead of time can make a huge difference.
So, to make sure everything heals perfectly and to avoid any chance of infection, there are a few rules to follow. For about 4 weeks, you'll need to put a pause on tampons, sexual intercourse, taking baths, or going swimming. Think of it as giving your body some dedicated, uninterrupted time to heal. It's really important.
Now, complications are not common at all, but it's always smart to know the warning signs. You'll want to call your doctor right away if you get a fever over 100.4, if you're bleeding really heavily, like soaking through a pad every hour, or if you have severe pain that medicine doesn't touch. And also any foul-smelling discharge. Just keep these in mind so you can act fast if anything feels off.
Okay, like with any medical procedure, we have to talk about the pros and cons. It's all about weighing the benefits against the risks, so you can make a choice you feel really good about. So let's lay it all out.
When you look at it, the benefits are huge. We're talking about removing those abnormal cells and stopping cancer before it can even start. That's massive. On the flip side, there are some risks, though they're usually small. Things like bleeding or infection, or in some cases, a very slight impact on future pregnancies. This is exactly the kind of stuff you'll want to hash out with your doctor because they'll know how it all applies to you personally.
And if you're wondering, does this even work? The answer is a resounding yes. Check out this number, 90%. That's the success rate. In about 90% of cases, the LEEP gets all of the abnormal cells. It's an incredibly effective treatment. So you've had the procedure, you've healed up, what now? Well, the LEEP is a big step, but it's not the last one. Let's talk about the long-term game plan for staying healthy.
Okay, this part is absolutely crucial. Follow-up care is everything. In a week or 2, you'll get the results from the tissue they removed. But the really big appointment is your follow-up pap and HPV test, which is usually about a year later. That's the one that really confirms everything worked and that you're in the clear.
And I know a big question for many people is about having kids in the future. Here's some really great news. The overwhelming majority of people who have a LEEP heal up perfectly and go on to have totally normal, healthy pregnancies. So you can definitely breathe a sigh of relief on that one.
So, our goal here was to give you the knowledge to feel more prepared and in control. And hopefully, we've done that. We'll leave you with this final thought to take with you. Because, being informed is powerful, but asking questions and being an active partner in your own healthcare, that's the real game changer. Thanks for joining us.